A woman in her early 50s is discovered wandering aimlessly with an unsteady gait and is brought to the hospital by police. When asked to identify herself, she speaks incoherently and is unable to state the time or her location. Her temperature is 36.4 degrees Celsius or 97.5 degrees Fahrenheit. Blood pressure is 158 over 96 millimeters of mercury. Heart rate is 102 per minute, and respiratory rate is 17 per minute. Her body mass index is 16.8 kilograms per square meter. Physical examination of the head and neck reveals bilateral temporal muscle wasting and dry oral mucosa. Both pupils measure approximately 3 millimeters and demonstrate sluggish reactivity to light. The neck is supple, she moves all extremities without focal weakness, and deep tendon reflexes are symmetric. What is the most appropriate initial management for this patient? A. Flumazenil. B. Haloperidol. C. Labetalol. D. Naloxone. E. Thiamine. E. Thiamine. Altered mental status, as seen in this patient, reflects diffuse dysfunction of the cerebral cortex and/or the reticular activating system. The differential diagnosis is broad and includes psychiatric disease, intoxication or withdrawal states, infection, metabolic abnormalities such as hypoglycemia or electrolyte disturbances, primary neurologic disorders, trauma, and end organ failure involving the lungs, liver, or kidneys. Chronic undernutrition, particularly in individuals with alcohol use disorder, predisposes to thiamine, vitamin B1 deficiency, which can progress to Wernicke's encephalopathy. This condition classically presents with a triad of confusion, ocular abnormalities, and gait ataxia. Early administration of thiamine in suspected cases is critical to prevent irreversible neurologic injury. Because thiamine serves as a cofactor for multiple enzymes involved in cerebral energy metabolism, administration of glucose before thiamine can precipitate or exacerbate Wernicke's encephalopathy. Therefore, thiamine should be given before or concurrently with glucose-containing fluids. When the etiology of altered mental status remains unclear after initial evaluation, empiric treatment of likely and high-risk causes, such as Wernicke's encephalopathy, is appropriate. Now, briefly reviewing the other answer choices. A. Flumazenil is a competitive antagonist at the benzodiazepine GABA receptor complex and is used for benzodiazepine overdose, which typically manifests with slurred speech, ataxia, hypotension, and depressed consciousness. The presence of hypertension in this patient makes this diagnosis less likely. B. Haloperidol is an antipsychotic for acute psychosis or agitation, but potential medical causes of altered mental status should be excluded before its use. C. Labetalol is effective in hypertensive encephalopathy, which usually occurs with markedly elevated blood pressure of at least 180 over 120 millimeters of mercury, and is accompanied by headache, nausea, vomiting, and confusion. The modest blood pressure elevation in this case is more likely secondary and should improve with definitive treatment. D. Naloxone is an opioid antagonist indicated for opioid overdose, which classically presents with pinpoint pupils and respiratory depression, often with a respiratory rate below 12 per minute. Conclusion: Wernicke's encephalopathy results from thiamine, vitamin B1 deficiency, and is most commonly seen in malnourished patients, particularly those with chronic alcohol use. Hallmark features include encephalopathy, ocular dysfunction, and gait ataxia. Management requires prompt empiric administration of thiamine prior to or along with glucose.
Thanks for studying with me. See you in the next video.